Every minute matters. A patient who looked stable an hour ago is suddenly confused. Their heart rate is climbing, their blood pressure is dropping, their respiratory rate keeps increasing. This is how sepsis often begins.
We must identify the trends early. A subtle change in assessment is key. This requires immediate and focused reassessment. Notify the team and prepare for interventions.
Welcome to Healing Hands Nursing. This video reviews the latest nursing priorities for recognizing sepsis, activating the sepsis bundle, and preventing progression to septic shock. Let's begin. Sepsis is a life-threatening condition that occurs when the body's response to an infection becomes dysregulated and begins damaging its own tissues and organs. In simple terms, the immune system goes into overdrive. Instead of containing the infection, widespread inflammation develops throughout the body. Blood vessels become leaky, circulation becomes impaired, organs begin receiving less oxygen and fewer nutrients. Without rapid intervention, multiple organ failure can occur. Sepsis can develop from many different infections. Common sources include pneumonia, urinary tract infections, abdominal infections, surgical wounds, skin infections, and infected vascular devices. Patients at highest risk include older adults, immunocompromised individuals, diabetic patients, recent surgical patients, and residents of long-term care facilities. As nurses, recognizing these high-risk populations is the first step toward early detection. Not all sepsis is septic shock. Sepsis is defined as infection accompanied by organ dysfunction. Septic shock is a more severe stage, characterized by persistent hypotension despite adequate fluid resuscitation and elevated serum lactate levels. A quick bedside tool commonly used to help identify patients at higher risk for sepsis-related complications is the qsofa score. qsofa stands for Quick Sequential Organ Failure Assessment. It evaluates 3 simple clinical findings: altered mental status, respiratory rate of 22 breaths per minute or greater, systolic blood pressure of 100 millimeters of mercury or less. Each positive finding scores 1 point. A qsofa score of 2 or more suggests an increased risk of poor outcomes and should prompt immediate clinical evaluation and escalation of care according to facility protocol. Remember that qsofa is a screening tool, not a diagnostic test. Many healthcare facilities also use additional sepsis screening methods and institutional protocols to support early recognition. Clinical judgment remains essential, and concerning changes in a patient's condition should never be ignored, even when qsofa criteria are not fully met.
Recognizing sepsis quickly saves lives. Draw lactates and blood cultures first. Administer antibiotics. Begin rapid fluid resuscitation. Monitor vitals and urine output. Every minute counts. Preventing sepsis is just as important as treating it. Always remember to perform proper hand hygiene. We must monitor dressings closely for any signs of infection, and assessing lines for any signs of infection. Education helps patients recognize warning signs. Many sepsis survivors face long-term complications. We call this post-sepsis syndrome. It often causes chronic fatigue and weakness. We will support your recovery every step of the way.
Sepsis is a medical emergency. Early recognition, rapid intervention, and strong clinical judgment save lives. As nurses, never ignore subtle changes in a patient's condition. Think sepsis. Trust your assessment. Follow evidence-based protocols, and act quickly when the warning signs appear. If you found this video helpful, be sure to like, subscribe, and share it with fellow healthcare professionals. Thank you for watching Healing Hands Nursing.